Kraft, for taking the time to talk to us today. Can you tell us a little bit about what you do in your community?
Sure. I'm Dr. Colleen Kraft, and I'm an associate professor of pediatrics at the Virginia Tech Carilion School of Medicine in Roanoke, Virginia. Right now I run a program called the Transitional Year Residency, but I am starting up a pediatric residency for the new medical school, so I'm looking forward to getting that up and going. But part of my job is also working as a primary care pediatrician in Botetourt County, and so I see lots of kids from around that part of the state.
A lot of important work you have going on, I'm sure, a busy schedule. So we've got a couple questions for you today. First, how do immunizations for children differ from adolescents as well as adults?
When you look at the immunization program, and we're immunizing young children, babies and toddlers, and then preschoolers, we're looking at the primary series or the primary immunizations for this population of kids. So these are the kids who are getting their first vaccines. They're the ones that are developing their first antibodies against these deadly diseases. When you get to the adolescent age, we are doing two different things. The first thing we're doing is helping to continue to protect our adolescents against some of the same deadly diseases that they were protected against as infants. So, for example, pertussis vaccine, the Tdap. The Tdap vaccine has a little bit less pertussis antigen in it than the DTaP, which is used to immunize children who are younger, but it helps to protect our adolescents and our adults from pertussis. There are also some new diseases that target adolescents and adults that we can now protect our adolescents and adults from getting. One of those is cervical cancer, and the human papillomavirus vaccine is something that does a great job of preventing cervical cancer. The important part of that is, though, that these children need to be vaccinated before there's any question of their becoming sexually active, because once they're sexually active, they're at risk for getting the disease. The whole idea for HPV vaccine and why we give it at 11 to 12 is that we're thinking prevention. We don't ask our families to think of a vaccine that they want to give their infant because they might want to protect them from polio versus pertussis versus Hib. We recommend vaccines. Same thing for our kids in the 11 to 12 age group. We recommend HPV vaccine because we want to prevent disease. We're all about prevention as pediatricians.
Great message. Why is it important to have adults immunized?
When you look at adults and immunization, we're doing two things. The first thing we're doing is protecting adults against diseases that adults get. So, for example, we will be protecting them against pertussis by giving them the Tdap vaccine. We'll protect them against hepatitis A and hepatitis B by giving them those vaccines. One of the newer vaccines, the shingles vaccine, or Zostavax, is something that protects against shingles, but not only shingles, but the really horrible side effects that some people get from having had shingles. So the first item is protecting adults. So one of the newest recommendations that you'll see out now is the Tdap vaccine for those 65 years and older. And we're targeting grandparents. We're targeting those folks who are going to get together with their infant, newborn grandchildren, and they might be a risk of spreading pertussis to those babies. So we're immunizing the adults to protect the young, vulnerable children in their lives.
And Dr. Kraft, for those people who may not know the clinical name, can you give us what pertussis is?
Sure. Pertussis is whooping cough. And in young infants, it causes severe coughing. They turn red and then they turn blue. They can sometimes obstruct their airway. They often have seizures or pass out with them, and they often die from pertussis. Pertussis or whooping cough can affect adults and can affect adolescents as well too. And what we see in that age group is what's called the 100-day cough. And what I see in my office is the 11-year-old who's come into my office, has been coughing for 3 months, is being sent home from school, even though they feel fine because of the cough. They have a cough that disrupts the class, and it's pertussis. It's something that is vaccine preventable.
Thank you. Final question. What advice would you give a parent concerned about their ability to afford vaccinations for their children?
Vaccines should not be delayed or avoided because a parent can't afford them. There's a wonderful program called the Vaccines for Children program, and this was a program that was started after the measles outbreaks in the 1980s, early 1990s. It's a program where if a child is covered by Medicaid, if a family does not have health insurance that covers vaccines, their children can still receive vaccines. Sometimes at their primary care doctor's office, and sometimes at rural health clinics or federally qualified health clinics. The other important thing about the cost of vaccines is that many of the manufacturers, and there are many programs that give vouchers or give some assistance to patients who can't afford vaccines, who don't fall into the category of Medicaid or vaccines not covered by their insurance. So there are lots of ways to get your children vaccinated if you don't feel like you have the means to afford it.
Very important message.
Yeah.
Thank you, Dr. Kraft.
You're welcome.